We always take forever to see the doctor and nurse is when you come.
Yeah.
I guess they're finally here.
They're finally here, huh?
Hi, how are you? I'm Autumn, one of the nurses here. Can you tell me your name and date of birth?
Lisa Graham, 9/13, 1999.
Okay. So you guys came in today because you have some breathing problems related to your asthma, and now the doctor has prescribed albuterol.
What's that?
Albuterol is a medication called a bronchodilator.
What's a bronchodilator?
So what that means is the medication is going to relax the muscles of the airway. Once the muscles are relaxed, the airway is going to open and allow more oxygen to come in, which is going to help Lisa to breathe easier.
Yeah, she needs to breathe, so that'll
Yeah.
be helpful.
That's true. Breathing is very important. Do you have any questions about the albuterol?
What is it going to do to her?
Well, you know, it's going to have positive effects. It also is going to have side effects that you need to be aware of.
Are these side effects harmful?
Some of them, one of them can be harmful. The main side effect is actually the wheezing that she experiences when she has an asthma attack. It actually gets worse.
What?
I know. It sounds strange, but that is the most important side effect of albuterol, and it can be life-threatening. So let's just say you take your medication and the wheezing gets more intense, which is obviously what we don't want to happen. If that does happen, stop taking the medication and call 911. Very important.
Dad, I have to take this medicine?
Well, that's what they say if you want to breathe.
So there are other side effects which are not life-threatening, but you still need to be aware of them. You can experience palpitations, tremors.
What's palpitations?
Palpitations are when your heart starts to beat very fast.
That happens sometimes when I drink my Red Bull.
Yeah, we're going to talk about the Red Bull in a moment. So other side effects, anxiety, nausea, vomiting. If these side effects happen, you do need to stop taking the medication, but you can just call the doctor. You know, these are not life-threatening side effects.
Well, so we don't have to get her an ambulance in.
No ambulance needed, only if the wheezing gets really, really intense. Are you taking any over-the-counter medications like vitamins, herbal remedies, home remedies, anything like that? No?
Not that I'm aware of.
Okay, that's good. That's good. If at any point you are interested in taking some type of herbal remedy or even a multivitamin, you need to contact the doctor first, because anything besides the albuterol could potentially have an effect. Not always, but you just need to speak to the doctor first before you go outside of the albuterol. Okay. Albuterol also has some drug-to-drug interactions. Albuterol reacts with MAO inhibitors or beta blockers. Those are for the heart and for depression. Fortunately, you're not taking any of those medications, so you don't really need to worry about it. Like I said, if at any point something else is prescribed for you through maybe another doctor, you need to contact the doctor here about your albuterol before you start taking anything else. Okay. Now, the bad news. Red Bull, Coca-Cola, caffeine of any kind is going to make the albuterol more intense. The feeling of...
I don't think you're going to be having that anymore.
Oh, come on.
The tremors, anxiety, even chest pain can intensify. Anything that's a stimulant effect, which is kind of like the hyper effects of the albuterol, is going to get worse. And that can be very stressful or even scary for you. Okay? You think you can give up your
Hey, now.
caffeinated beverages?
It'll probably be difficult, but we'll do what we can.
Yeah. Well, your breathing is important, so I know.
I can't watch her every day at school, so.
That's true, but she'll deal with the consequences if she doesn't make the adjustment. So no questions so far?
No, I don't think so. How's she going to take her medicine? What is this medicine anyway?
Well, the albuterol comes in an inhaler, so you're going to take puffs of it. Okay. It comes in what's called a metered dose inhaler. So every dose is calculated on the side, so you know how many you have to start with and how many as you go along. Okay. So this is the inhaler. Oops, wrong pocket. Okay, it looks like this. This is the medication, okay, canister, and this is the actual inhaler. And you see these little numbers here? That's where it's going to register how many doses that you have to use. Okay, so you know when you're getting low, and you can call to get your prescription refilled. All right? Okay, so what you're going to do is like I just did, really simple. You get the canister, you got the inhaler, put them together. So before you take it, you're going to shake it up, okay? Take off the cap, put it in your mouth, puff, press down, and a puff is going to come out, okay? Now, before you get to that point, if you have a new canister, you're going to have to what's called priming it 4 times, okay? Priming is just holding it away from you and spraying it 4 times, okay? Shoot 1, 2, 3, 4, okay? Pretend it's making that puff sound, okay? Then you can start it. You don't have to prime it again until the canister is done unless you go without using it for 2 weeks. Then you're gonna need to do the priming again 4 times, okay?
Well, she's busy enough. She'll probably need it every day.
Okay.
Mm-hmm.
So after it's all primed, what you're going to do is you're going to shake it before, put it in your mouth, take the puff, you're going to hold that, then exhale, then you're going to wait 1 full minute before you take the second puff. You probably see people around doing really quick puffs. You definitely don't want to do that. You want to give your lungs a moment to adjust to the medication before you give it another dose. Okay? Any questions so far?
It looks pretty simple so far.
Okay.
I think we might be able to handle it.
Okay. So why don't you show me how to put it together and then how you would take the medication.
Is this the back or the front?
That's the back. So this part, this is where the meter doses are going to show up, and you want them to show through this window. Okay, so that's how you're going to know how to put it together. Okay? And I'm going to have you actually take a dose so you can start to feel better. Shake it.
So small.
Yeah. But the medication is powerful, so.
And then just spray?
Put it in your mouth. Spray and inhale at the same time, okay? And keep your mouth closed over it. Okay, wait a minute. Exhale.
I have to wait a whole minute?
It's very important. Very important to wait that minute.
Not everybody waits a whole minute.
I know, but they could potentially harm themselves by doing that, so better off doing it the
Did you
correct
hear
way.
what she said? You're supposed to wait a minute.
Okay, go ahead. Do your second puff.
I have to shake it again?
No, you don't have to shake it again. You're okay. You already shook it up pretty good. Okay? Right now, as it stands, is every 4 to 6 hours when you're having your symptoms of the wheezing or the chest tightness or chest pain, or 15 minutes before you start to exercise, even if you're not having symptoms, because it can prevent the symptoms from coming on. So, one thing that you do need to know, it's very, very important not to exceed the dose, okay? If the inhaler is not helping you, or like we said, we talked about the side effects, then you just need to call the physician and go from there and possibly have you come back in here to the office. But don't, if you take the inhaler and then an hour later you're still not feeling better, don't, start puffing away. This has the side effects, this has the drug-to-drug interactions, the drug-to-food and beverages interaction, things for you to avoid, things for you to know, and it also has all of our information here at the office. The physician's phone number and the nurse's desk as well. How are you guys feeling? Are you understanding everything?
I think she can get it.
Okay. Okay. How about you, Lisa? How you feeling? You look a little overwhelmed.
I'm starting to feel the palpitations.
Okay. I bet. It's probably, yeah, okay.
Just
that makes
as long
sense.
as my little girl can breathe, that's important.
Okay. Well, we're always here at the office if you need us. We have messaging after hours if something happens, but like I said, if it's the wheezing and it's intense, call 911 or go to the emergency room immediately. Okay? Any other questions? Okay. Nice to meet you. Take care.
Thank you
Thank
for
you.
your time.
Bye.
Mhm.